weeks ago, I got this message from a friend of mine who was complaining about nipple discharge from both of her breasts. It came with a second picture which indicated the color of the discharge, which was chocolate brown in color. Nipple discharge refers to a fluid-like discharge either from both sides or on one of the nipples, with or without you squeezing it. The consistency doesn't really matter. It could be thick, it could be thin, it could be sticky, or it could just be fluid-like. There are actually a lot of factors that could lead to nipple discharge. One of it is hormonal imbalance. Any hormonal issues that affect the hormone prolactin definitely causes or might cause breast nipple discharge. Another one is lactation following pregnancy and childbirth, of course, the milk production. We have excessive breast stimulation from sexual intercourse. There is benign tumors that are non-cancerous. We have infections. There's so many infections that can cause breast nipple discharge. We have medications. Stress can also cause it, and then very, very important, the breast cancer itself. So like I said earlier, nipple discharge can be normal or it can be abnormal. Normal in the case of lactation, where breast milk comes out, and also during excessive breast stimulation from sexual intercourse. While it could be abnormal if it's caused from infection, if it's caused from stress, if it's caused from tumors from any part of the body that leads to discharge from the breast, or if it is caused from the main cuckoo, which is breast cancer.
Here's when you should be concerned. If you are a man, if the discharge is bloody, if the discharge comes from one nipple and not from both nipple of the breast, if it comes even when you don't touch or squeeze it, and finally, if you can feel a lump in the breast, or if you have breast pain, or if there is any other unusual symptoms.
You should go to the nearest hospital. Go to the nearest health center or hospital around you, see a doctor and explain all symptoms. Your doctor will most especially order for an imaging test. He will ask for an x-ray and an MRI. He or she might also order for a breast biopsy, which is a sample of your breast being observed. He will also order for hormone blood test. This is supposed to check the level of the hormone prolactin in your blood, just to determine if it is in the normal range and if there is any deficit or increase that might be causing the discharge. On some cases, you might also order for a contrast test. This is done in the radiology unit and might be expensive.